Hello, this is Dr. Shannon Da Silva, and today I will be going over the ultrasound presentation related to gynecology. I put a picture in here of a lovely uterus with flowers because I know that this is not everyone's favorite topic, but I just want to remind you that during the course of a woman's life, they will be in the gynecologic phase much longer than the interpartum and antepartum period of time. So I know that this part is not always the most favorite topics of the students, but this is the part that as midwives we can make such an impact in that lifelong care with the women that we serve. So I hope that this presentation helps you to be more confident and helps build your understanding of gynecology related to ultrasound. So we are just going to do an overview for midwife students and foundations of GYN ultrasound. So we'll look at indications for ultrasound, include gynecologic ultrasound, include abnormal uterine bleeding, pelvic pain or mass, infertility evaluation, making sure the IUD is located in the correct place, a patient that has amenorrhea or postmenopausal bleeding, and then a suspected adnexal or ovarian mass. So we want to look at the key structures, so the uterus, the ovaries, the cervix, and the adnexa or the cul-de-sac. So when we're looking at the uterus, we look at the orientation. Is it anteverted, retroverted? The size, we want to measure the length, the width, AP dimensions, the myometrial texture, so it could be homogeneous, or you could locate a fibroid. So you can see in the bottom image there is a fibroid. And then looking at the endometrial stripe, what is the thickness, what is the echogenicity in the central line. When we're looking at the ovaries, looking at the location typically medial to the internal iliac vessels, we want to measure the size, the height, width, length, and volume. And then the follicular activity, what size are the follicles, how many of them are there cysts, are there solid components in the cyst, if there is a cyst. And then we look at the cervix, what is the length? So especially really in OB is where we see this measured, not really in GYN patients or gynecology patients. And then you may see Nabalthian cyst, which you can see here in the cervix, and they're common and they're benign. So when we look at the adnexus, so in the cul-de-sac, we're looking for masses and free fluid. Free fluid can be a physiologic, or it can be concerning if it's a lot, like in the image at the bottom. And the image at the top is showing an ectopic, so you can see the ovary, and then next to the ovary is what we call the ring of fire, and so that's just showing blood flow, and then you can see blood flow in the middle, which is where the fetal pole is, and so that is consistent with an ectopic. Often with an ectopic, we are not able to see it in ultrasound, so it's not common when we can see it in ultrasound. So when we're doing imaging, so some techniques and tips, when we're doing a transvaginal ultrasound, it's best for resolution and early detection of disease processes and pregnancy. They need to have an empty bladder when you do a transvaginal ultrasound, and we typically start longitudinally in the sagittal plane, and that puts it at anterior and posterior, and we sweep through the uterus and then rotate 90 degrees for the transverse plane, and then sweep again through the uterus. The transabdominal ultrasound, we need a full bladder to help with an acoustic window to help the sound waves go through. You have a wider field of view but lower resolution than the transvaginal ultrasound, and this is used for large masses, fibroids, and then patients that that are virgin that have not had intercourse. So some of the common pitfalls with gynecologic GYN sonos or gynecologic sonos is not identifying both ovaries. Sometimes people mistake bowel for adnexal masses or misjudging the endometrial thickness if it's not in a perpendicular, if the ultrasound probe is not perpendicular, and then overlooking a retroverted uterus. So some common findings on ultrasound, so you could find a simple ovarian cyst that looks like anechoic, thin-walled, posterior acoustic enhancement. Dermoid cyst would be solid, hyperechoic mass with shadowing. A complex cyst would be a complex mass, so you'd see a cyst with different things inside of it. A hemorrhagic cyst looks like lace-like. Internal echoes may have a fluid-filled level. A fibroid is usually hypoechoic, well-defined. It's usually complex, as you remember from that image earlier. It may distort the uterine contour. A polyp can have focal echogenic endometrial thickening, but this is better seen with a saline infusion sonohistogram. And then PCOS would be identified with multiple peripheral follicles, which we call the string of pearls, and increased ovarian volume. So they measure the ovary and the volume is increased. And then in IUD, we describe that as a hyperechoic linear structure. Sometimes people say reverberation artifact, and the arms would be located at the fundus. These are some resources if you want to look at different ultrasounds. Some of these, one of the sites has a really good description of what you're looking at and making sure that you're identifying the correct landmarks.